Welcome to World Nursing Lecture Room, a learning space for nurses, student nurses, healthcare professionals across global. Here, we talk about or we break down complex nursing concepts into simple, clear, and practical way. From clinical to skills to exam preparation, case discussion, and professional growth tip, we got you covered. Our goal is to empower you with knowledge and improve patient care and build confidence in your nursing journey. Subscribe, learn, and grow with us, because nursing, if you are a nurse, nursing or learning never stop if you are a nurse. Subscribe, like the video, share, comment. Don't forget to turn on the notification bell so that every time I post a video, you will be the first person to be notified. Today we are going to learn some mnemonic, not some, but one of the mnemonic, and this is about care of patient in attraction. A mnemonic that we are going to talk about, or abbreviation that we are going to talk about, is traction. So if you have been asked question, or you have been told to explain, the question can come like this: what are or how can you care for a patient on attraction? How can you care for a patient who is on attraction? First of all, what you have to know, or the mnemonic that should come at the back of your mind, is traction. So first of all, you have to know that with traction, you have to maintain the alignment. So you have to maintain skincare. It must be there to prevent pressure sores, buildup of pressure sores, especially under the straps, the bandage, or the pins. The skincare must be a factor there, or should be something that you consider there. Also, cardiovascular check, which you monitor the circulation, the sensation, the movement of the limbs. Yeah. Also pain control, because when you are on traction, that means that you have a fracture, or that patient is having a fracture. With fracture, sometimes patients usually feel pain, so you have to know how to maintain, or how to control pain, or how to reduce pain on a patient. And then infection prevention. If you're already a nurse, a nursing student, a professional nurse, you know that you know how to do to prevent infection. The cleanliness of the traction, the cleanliness of the ward where the patient is staying, the cleanliness, giving over antibiotics. Yeah. Also about the mobility and exercise, you can help the patient to move around, so that you can help the patient to move around, or the patient can do some exercise where she is lying, because the patient also, when he or she is on traction, they should not be moving. They should not get that large mobility or severe mobility that can interfere with the alignment. Also, we can talk about when we are talking about attraction, you have to know you have to assist the patient with toileting, yeah, so that you prevent constipation, and also urine retention. So you're supposed to I was saying that you help patient with toileting, so that you prevent constipation and urine retention. Patients sometimes can have catheters, but catheter also increase infection. So if patient can move, you can help them with just how they can excrete the urine. Yeah. Also psychological support, reassure the patient, explain the procedure, and this will help reduce the anxiety. So we say that if you've been asked about this question, how to care for a patient who is on traction, there is the mnemonic that should come at the back of your mind is traction. I don't know if you're able to see your traction. So traction, the first T is temperature. You monitor extreme warmth, you ensure circulation, so temperature. So let us highlight or list the meaning of that. So traction, T, we have temperature. R, we have ropes hanging freely. A, we have alignment, we have talked about that. Circulation, C, we have circulation check. We have another T, which is type and location of the fracture. You have to know where the fracture is, so that even you know where that traction should be put. And then also I, we have increased fluid intake to prevent kidney stone, to prevent constipation, to also to ensure circulation. And also we have which is overheated trapeze, which help the patient to move. And also the last one is the N. N is no weight should be on the floor or the bed. Yeah, no weight should be on the floor or the bed. The weight must hang freely on the bed. The weight that has been put. Yeah, I don't know if you are getting what I'm trying to say, but if you are a nurse, you already have the idea of what I'm trying to say. No weight should be on the bed or the floor. The weight of the truncheon should hang freely on the bed. Yeah. So the only thing that I wanted you to take home is mnemonic traction. And if you have been asked that question, just use mnemonic traction. T, temperature, R, ropes hanging freely, alignment, A is alignment, C is circulation check, T is type and location of fraction, I is increased fluid intake, overheated trapeze, not or trapezium, overheated trapeze, and N is no weight should be on the bed or the floor. So the meaning of all those, or the rationale of all those, if you are a student, kindly go and look for those rationales of the mnemonic that I will help you with it. So if you've not subscribed, like the video, share, comment. I think I'm going to insert a video of what I'm talking about so that you're able to see what I'm talking about. Bye till next.